I learned on the internet that probably the disease was about a 15-year disease. If I did nothing 15 years from now, I would be dead. And I really wasn't prepared for that.
4 years ago, I was diagnosed with prostate cancer after many years of doing annual PSA exams. And the PSA exams revealed that I had a high level, and that was closely monitored because I have a family history of prostate cancer, and my father passed away from prostate cancer 8 years ago.
When I was 45, I had a friend had a problem with cancer, and he made a suggestion to me before he died. And so when I was 45, I started getting a PSA exam every other year. And I did that till the time I was 50. And then at 50, I decided I probably should go every year. Then just before I was like 53 and a half, I went and had another annual. And that's when they found my prostate cancer.
There were a couple of things that kind of moved me to get something done. One is that my stepfather-in-law died of prostate cancer, and he had made the decision to do nothing. And when he died, he weighed 95 pounds. And as I researched the Da Vinci machine itself, I found a lot of confirmation that the recovery times were quicker, the side effects were less, and it looked to me like it was probably the direction to go.
So after researching the alternatives and studying the different methods of trying to get rid of my cancer, I opted for the Da Vinci method. And the reason I chose that is because I have a very active lifestyle, and I wanted to be able to continue the life as I knew it. We scheduled the surgery. The surgery went very smooth. I went in at 6 o'clock or 7 o'clock on a Monday morning, and I was home at noon on a Tuesday morning.
I only had to stay 2 days, so I really did have a lot faster recovery right away off the bat. I got to go home soon.
I was actually surprised at how well I felt. I'd actually arranged for time off at work and found myself thinking, I guess it's time to go to work. So my recovery is really faster and better than what I had expected, because I walked in there anticipating the worst and came out saying, wow, I'm glad I did what I did.
Some of the longer-term side effects, he said it could affect your sexual performance, and there are things that we can do to help that. You may have an incontinent problem to some extent, and we have ways of dealing with that. To my surprise, I didn't have any of these problems.
It took me about 6 months to get feeling back to the old me again, which was being an active person, and that enabled me to do all the things that I had done before surgery, which includes rafting, skiing, flying, golfing, weightlifting, running. So I lead an active lifestyle, and it hasn't slowed me down a bit in any of those activities.
Well, and as far as life after my prostate, it's great. It's back to the way it always was. I'm able to go out and enjoy people like I'm around, and my cattle, and my wife, and my life is just back to where it was always at. And you know, I told Doc one time, one of my visits, I said, you know, Doc, I said, I don't even miss my prostate.
I still don't see any real alternative. If this were to happen to me again, I'm very happy with the decisions that I made.